Hello, and welcome to this presentation on how to solve your mental health insurance problem claims. My name is Denny. I work at and founded Therathink.com. We help mental health providers with their insurance billing. And today we're going to walk through some 80/20 specific cases of why claims go awry and what you can do to solve them. Before I begin, preamble would be that if this presentation sounds like a big headache, you might consider hiring a mental health insurance billing service like Therathink or a different one to help you with your problem claims. This isn't the kind of work that you signed up for when beginning private practice. And while working with insurance clients is instrumental in many successful practices, it's certainly a intensive process. So many providers that we work with do find it to be most efficient and cost effective to take on one new client or just pay a small amount of their income to an insurance billing service to not deal with any of the following headaches. But if you don't want to do that, you want to go about it on your own, totally understand. And here's a rough sense of how to do so. The first thing to do is to identify the problem going on with your claims. And there can be multiple problems with claims, but they will happen sequentially. And this is a rough look at that sequence. The beginning of which would be that claims are not processing through your EHR or clearinghouse whatsoever. They're not getting over to the insurance company themselves. Maybe they do end up getting over to the insurance company, but they're denied at the insurance company for a variety of reasons. They could be denied for being out of network, for being a carve-out policy, going to the wrong insurance company. Maybe you have the wrong NPI and tax ID combination of claims, of information, to file over to the insurance company. It could be that you're missing modifiers for telehealth or your license or the place of service that you're conducting claims sessions at, or a taxonomy identifier might be missing. Perhaps the client has primary and secondary insurance, but they've only given you their secondary insurance card information, and claims are being rejected for not being filed to the primary. Authorization may be required. And finally, if none of the claims were processed in a timely manner, timely filing would be at fault. It's possible also that even if claims are paid, they're not paid correctly. Maybe you received a benefits quote initially that stated the client had a $20 copayment, and now claims are going to their deductible. We'll also talk a little bit through that as well. Before getting into specifics, it's a good idea to look at the general most common cases, because while it's true that you have many different reasons for claims being processed incorrectly, the 80/20 of it tends to be that you are not in network with their plan or authorized to work with them at all, and as a result, your claims are being processed as out of network or denied as a result. Or even more likely, the information that is being billed out to insurance is incorrect. Maybe your address has been updated, maybe the client's subscriber ID had a 0 instead of an O, or vice versa. Maybe their name is spelled differently than on their insurance card than the one that they gave you. Maybe the insurance company has your organizational NPI instead of your individual NPI on file. Maybe you're using a different taxonomy code or a tax ID. These are things to call up and talk to the insurance company about correcting. Now, with an EHR clearinghouse, the typical issues are going to be correcting information about the client's subscriber ID, their zip code, your practice information. Maybe the zip code, the 9-digit zip code you're using is incorrect for your practice. Could also be that a digital claims enrollment is required to work with and send insurance claims over to that payer, that insurance company like Medicare, for example, in which case you would need to do or redo the digital claims enrollment. Could be that you're missing a taxonomy code, a license level modifier, or other coding issues as well. These can cause errors before the claim even makes its way over to the insurance company. The clearinghouse acts as a filter between private practices, insurance billing services, and the insurance companies to make sure that the information is being formatted correctly and pertains to a real client over at that insurance company. And as a result, it could well be the case that those issues are being taken place uh, from the outset. So you're going to need to correct these things. You'll usually get a remittance notification of some sort, an error that will state what needs to be corrected. You can also contact your clearinghouse and ask what's going on with the claims at that point as well. And of course, the billing service will do this for you, or at least ought to do this for you. We certainly do this over at TheraThink without providers needing to mention it whatsoever. When fixing denials, you're going to also need to obtain the original claim ID, either from a EOB that you received in the mail, or from your online account, or via a phone call to verify the information. You'll need to update the claims data with the corrected information, and then you'll need to refile the claims as corrected on a CMS 1500 form in the box 22. You'll see a little image here in the presentation. In the resubmission code, you'll need to type in 7, enter 7, and then on the original reference number, you're going to want to enter in the original claim ID. And then you'll need to resubmit the claim via your clearinghouse to get it reprocessed. And again, what needs to be corrected will depend on the denial or error that might take place. So if you need to refile the claim to a different insurance company, you might not need to correct any of the information beyond the insurance brand and address and payer ID for that claim. Whereas, for example, if a taxonomy code needs to be added, you'll want to post that in the appropriate section of the CMS 1500 form or digital claims submission file. Again, over at TheraThink, we take care of this for you in the background. So if there is an issue, we are solving this for you without you needing to notify us whatsoever. Part of our process is verifying the information with insurance companies as claims are being processed so that we find out proactively when there are denials or corrections that need to be made, and as a result, completing them, getting the original claim ID, refiling them as corrected, etc. A lot of this can be mitigated by eligibility and benefits verification phone calls up front so that you know you have the right information on file, that you are in network with their plan, that authorization is not required, or if it is, it's obtained in a timely manner. And those are things that we also do as part of our billing service. Again, quite a bit of work, unfortunately. There's no shortcut or magic wand that we at TheraThink as a billing service or you as a private practitioner can wave to shortcut these issues. It's just part of insurance billing, and it's a bit of a headache. Now, if there is a benefits payment issue, one thing that is important is to have done that eligibility and benefits review phone call before you work with a client. Of course, it's important to do so to make sure that the client has active coverage and that you can work with their insurance plan. But also on that phone call, you can get a reference ID for that phone call with the representative's name that you spoke to and the date that you did that phone call. And then you can refer back to that information when you argue with the insurance company ultimately to get the claims reprocessed based on the original eligibility and benefits verification quote that you received from them. You'll need to reference the date, representative, and reference ID from the phone call that you made to win that case and have them actually reprocess the claim successfully for you. And if you don't do any of that work, you'll have basically an impossible time doing so. So a good idea to make sure you verify eligibility and benefits and record that information in a systematic manner. And again, broken record, we do this as part of our service at TheraThink because we need to make sure that the providers that we're working with are able to work with their clients. And when these things do come up, which they will inevitably, that we can actually fight on behalf of the provider and the client ultimately to make sure the sessions are being reimbursed in an appropriate manner. So in summary, you need to make sure you're doing your diligence up front to mitigate problem claims, eligibility and benefits verification, verifying your claims, your provider practice information over with provider relations at each insurance plan. And then you'll need to identify the problem going on with the claim itself. Usually a phone call is required to do so. Correct the information, including filing the original claim ID and corrected claim identifier with the claim itself, and then follow up in a timely manner over with insurance to make sure that the claim was reprocessed successfully and paid in full. Now, if this sounds like a terrible, terrible situation for you, then consider calling TheraThink. You can schedule with us at therathink.com/schedule, THERATHINK.com/schedule, or send me an email, denny@therathink.com. I'd be happy to chat quickly and see what's going on with your billing, and maybe we would be a good fit to help. There are some cases where we cannot wave a magic wand and get you to become in network when you're out of network. And so what we do as much as we can is mitigate all of these issues upfront with a lot of diligence and homework. And any billing service worth its weight will be able to do so for you as well. So when looking for an insurance billing service, be it TheraThink or others, make sure that they're verifying eligibility and benefits for free as part of your service offering, and make sure that they problem solve claims for you without your intervention on the back end as well. Thanks so much for following along as we talk through handling problem claims. And again, if you are interested in working with us, feel free to head to therathink.com or schedule directly with us at therathink.com/schedule. Thanks so much.